Hello, my name's Dan Stuckey, and I'm chairman of the board for ARCHway Institute. And I'm here today with Drug Free Punta Gorda, giving them an update on where ARCHway is now and where we're going. So I appreciate you taking the time to watch the video. So this is what I'm going to cover today: what ARCHway does and why, how ARCHway does its work, examples in Southwest Florida, including Charlotte County, ARCHway's national impact, our impact in Southwest Florida, how and why we partner with organizations like Drug Free Punta Gorda, how you can help ARCHway and Drug Free Punta Gorda, and then ask for some feedback, both positive, interesting, and negative. So many of you already know our story, but there's some things I'd like you to know about our story that will show up in a lot of other stories that I'm going to share today. So Dan and I, we have 4 children, and one of our sons was dealing with a drug addiction disease for about 5 years and in and out of about 4 to 5 treatment programs. Our family was in crisis. And Jan and I were talking about where we would bury our son, whether it would be in St. Louis, Missouri, or back in Ohio. At our worst crisis moment, we met a family that runs a treatment center and sober living house. But the bottom line is we found a family and somebody who truly cared about us and took the time to explain treatment options, timing, housing, jobs, family counseling, the whole gamut of what we were going to be dealing with. In his first month of recovery, John had a vision of creating a business and giving all the profits to treatment centers to let his friends get help that were currently being turned away. ARCHway was then created between the Stuckey family and the Menzies family. The Menzies ran the treatment and recovery housing to really help make John's dream come true. But here's some key points I want to make, because it'll tell you a whole lot about what ARCHway does and why we do it. First of all, the family's in crisis. We were in crisis, and we didn't know where to turn. It's hard to even think when you're in a crisis mode. You don't think soundly. We found a family that cared about us. It's a big key point. We found they provided family and educated our family about the disease. We got family counseling and coaching, not just for our son, but for the entire family, because we're all in crisis mode and we all needed counseling. We got treatment for the chemical dependency John was dealing with, and then we got treatment for recovering John's life and dealing with some of the underlying mental health disorders that John was dealing with. And then we went on TV and radio, and then an amazing thing happened. While we thought we were alone dealing with this disease, many of our friends and coworkers started coming out and asking for help for their loved one, because they were going through the same process. And basically, our message was one of hope. Again, this was our story, but you can see in this what will become the foundation for what ARCHway does. So our vision, ARCHway's vision, we envision long-term recovery for everyone impacted by substance use and co-occurring mental health disorders. And the capitalization of ARCH in ARCHway has meaning to all the folks at ARCHway. Our son, John, said 4 things had to happen for things to really change in our country. The A stands for awareness. We needed to bring awareness about this disease to so many people and talk about it as a disease, because it's going to take a whole community to help address this. Recovery, the R in ARCHway, really, we're looking for long-term recovery for the individual. Community. If one part of the system's broken, the whole system's broken, including if the community itself is not supportive of somebody in recovery. And then health. you need to deal with not just the substance use, but the total health of the individual. And that's what we believe in. So I just wanted to put some statistics out there that that will drive how difficult it is for folks to get into get into recovery. First of all, it's a huge problem. 1/3 of the families in the US are dealing with this with a loved one in their family that has a drug or alcohol addiction disease. 1 out of 10 people over the age of 13 in the US have this disease. Here's the big problem. Only 20% ever seek professional help, with the #1 reason being the stigma attached to the disease. And a lot of that is people don't seek help because they're worried about what their employer will say, their neighbors will say, their family will say, and so they keep trying to hide it and not asking for professional help or try to deal with it on their own. 9 out of 10 people who are seeking help are turned away because of lack of beds, lack of money, or for whatever reason. You just take those top statistics and you can already start figuring out just the odds of somebody getting professional help and that's trying to get into to recover their lives. And because most folks have burnt so many bridges with their disease, $500 can be the difference between getting help or not getting help. Typically, both the caregiver and the individual are in crisis mode trying to navigate the system. More the caregiver, because the individual is medicating themselves, self-medicating, and the caregiver understands the consequences better of what's going to happen if they don't get professional help. So keep these statistics in the back of your mind as you see the rest of our slides. But with that, probably the best way to describe ARCHway is that we're advocates for the families and the individual. And that means we are there to help them because they are in crisis mode and everybody needs an advocate. We don't get referrals, compensation to help find a treatment center. We fundamentally are totally focused on helping the family get the resources they need. And so how do we work? Because we're advocates, the first thing is we try to change the stigma through education and awareness. We'd really like to see way more than 20% of the population that's dealing with this seek professional help. And we can only do that by educating the community, the families, and the individuals about this disease. One of the big things we do is we have a program called ARCHway's Advocates for Hope. And this is where we give free peer services, providing supportive conversation, guidance around treatment and recovery resources available to families and individuals across the country. Obviously, these aren't free services, aren't free to ARCHway, and this is where our donor base pays for, through their donations, for us to have people on call to talk to families and individuals. We've just all learned from our own personal experience that when you're in crisis mode, you don't want to have the first question be, so, what insurance carrier you have. And this also allows people to settle in and really tell us what's happening with them. We also, through this peer services, we can also find resources and give them resources up to and including some financial support through our scholarship program if people are in need of money to get into treatment. But many are just asking about where do they get help, what kind of questions they should be asking, help for the caregivers as well as the individuals. So again, bottom line here is we are the we are the advocates for the family and the individuals. So how do we change and educate the community? We have so many different ways of doing this. We have speakers that go out and speak for free. We have YouTube videos. We have a library of 120 videos to help drive down and educate families, communities, and individuals. We have our website. We have all sorts of events. We've written a book about this because everybody likes to learns in a different manner. We also have lots of events, and a lot of people think maybe the events are fundraisers, and they are, but it gives us an opportunity to get folks to come out from the community, to come out, get involved in things like golf or trivia night or a dinner or a band, and we get a chance to educate them about this disease. We take a short amount of time at all our events to educate folks. And then typically a funny thing happens is within 24 hours, we'll start getting text or phone calls of people asking for help. So we have many, many different ways we try to get the message out about this disease. Probably one of the best ways to again talk about what ARCHway does is to tell a few stories that we have down here in Southwest Florida. We counsel or coach about 101 families last year. I've just got a few where people are willing to and want to share their stories. But some of the key points you'll see over and over. Again, the family's in crisis, doesn't know where to turn. They need to find an organization that cared about them. And we hope that's ARCHway. We educate the entire family about the disease and the barriers to recovery. We help them find family counseling, and we talk to them about both treating for the chemical dependency and treatment for recovering the individual's life. So one family is the Devine family. Kim Devine, who lives in Punta, Gorda, heard about ARCHway as she was a city council woman. And she heard at a city council presentation that ARCHway gave, and that's how she heard about it. Again, people hear about ARCHway in so many different ways. Her daughter lived in Colorado, and she reached out to Jan and I about her daughter because she couldn't find any resources or couldn't find where to get help in Colorado. Our Advocates of Hope program at that time was John Stuckey and a board member, Lisa Callahan, got Kim information and helped her find resources in Colorado. In this case, they didn't need a scholarship. They just needed to find qualified resources and answer their questions. Kim comes back, tells her story at an ARCHway charity golf outing. Our daughter is doing exceptionally well. And now Kim and her family are an ARCHway Hope Fund sponsor. Basically, we never asked for money when she was in crisis mode. She decided to try and help the next person up. And I've got some videos here of Kim telling her own story. But you can see her quote was, "When I was at the height of our family crisis, ARCHway was just there for us, and they reach out to us within 24 hours. Another family was the O'Brien family. Again, here in Punta Gorda, they heard about ARCHway through our charity golf outing. Again, they reached out to us about their son, Danny, who lived in Charlotte County here in Florida. Our Advocates of Hope program talked to Danny, and they realized he needed both a new playground and new playmates to really get his journey of recovery going. Danny ended up going to a treatment center in St. Louis, as well as went into a men's recovery housing in St. Louis as well. And he did need a scholarship, which ARCHway provided. the O'Briens come back and tell their story about how at an ARCHway charity golf outing. And Danny is also doing well. And you can see their video of them telling their journey on our YouTube channel. And basically, Rich said, I got my son back, thanks to ARCHway, with lots of tears when he presented. The McLaughlin family, Todd and Terry, heard about ARCHway through a local realtor here in Punta Gorda, as they were retiring to Punta Gorda from Colorado. And the realtor, and they talked about their son and one of their fears of leaving Colorado. And the realtor asked them to reach out to Jan and I about their son, Cole, who lived in Colorado. Again, our Advocates of Hope program, peer support specialists who are in long-term recovery, talked to Cole and again realized he needed a new playground and new playmates. And they also got Cole into treatment in St. Louis, as well as into a men's recovery housing in St. Louis. He didn't need a scholarship. Cole was doing great. And again, the McLaughlin family is an ARCHway Hope Fund sponsor, so they can pay it forward and help others on their journey. We just heard from Cole that he just recently had a son and sent ARCHway a note that basically said, there was a time I never thought this could happen. Another one was Ryan Hope House. This is one of the treatment centers or recovery housing, knowing what ARCHway could do, and they heard about ARCHway at a Fort Myers dinner. The actual Women's Sober Living House reached out to ARCHway for a scholarship for Ashley. Ashley was pregnant with no support system and had no financial means to get help. And ARCHway was able to get a scholarship and get Ashley into a recovery program. And she and the child are doing fantastic. And Ashley did come back and talk at Fort Myers, ARCHway Fort Myers dinner to tell her story and thank everybody for their help. You see lots of other kind of stories. And again, people hear about us from so many ways. We've had local restaurant owners hear about ARCHway at a chamber breakfast. They reach out for an employee and ask ARCHway to contact the sheriff's office for the individual because they were nervous about contacting the sheriff's office about getting into their drug addiction recovery initiative. But other ones, we have local citizens come to a charity tennis event. You get the idea. People, we have this large array of way to get our name out there and talk to people one-on-one, and then they feel comfortable reaching out to us for help once they trust us. So here's one of the latest one. A Charlotte County resident attends an ARCHway charity tennis event for 2 years and understands what we do and how we do it. That resident texted and called us and said he had a friend in crisis. The friend needed immediate treatment for suicidal thoughts. He was being evicted from his home with no money. And the resident and Jan and Dan and myself and my wife and a peer support specialist all got together to talk about the situation, and then Emily got to talk to the individual directly. And she worked with providers in Southwest Florida to make sure they found the right place to fit both the chemical dependency and the mental health issue, and having the long-term therapy that the individual needed to give them the best shot at starting a journey of recovery. And we got that person in place, and we recently just got a note that the individual continues to do quite well, and is very hopeful and optimistic about their journey right now. But obviously not all our stories are successful. We've had a lot of friends and individuals that have succumbed to this disease, like you hear so much about in the press. But however, ARCHway supports these families that are grieving. And many times the family thank us for giving them quality time that they never thought they would have. And a lot of times they also create hope funds and donate money to help the next person on their journey. So you get the idea. We basically are the neighbor next door that you want to talk about, want to talk to, and understand, because we understand this disease. We can have personal conversations, educate the individual, and arm them with the information they need to go find a program that is best suited to them. The rest of this is going to be a little more about ARCHway nationally, to give you a feel for the scale of ARCHway, both, and also what we do in Southwest Florida and Charlotte County. So we have a very, very diverse set of directors. We're very proud about our diversity of directors. We have peer support specialists. Those are individuals that are certified by the state, but are in long-term recovery themselves to help others on their journey. We have caregivers on our board, people that have been on the journey, understand what people are going through. We have doctors in addictive medicine. We have treatment providers, therapists, ministers, business leaders, retired judges and lawyers, and we have a senior researcher on best practices for treatment. So we have a very, very diverse board and staff, and they're all around the country. They're not all in one location. Nationally, in 2021, we raised $395,000, which was quite substantial for us. It was almost up 30% from the previous year. We reached over 10,000 people with our education program, and these are programs where we gave virtual educational events, Zoom calls, in-person education. It does not include when we might have an article in the paper or be on TV or radio, because trying to count how many people we impacted there would just only inflate the number to almost an unbelievable number. But that 10,000 is very conservative of how many people we've reached with our story. Last year, we directly served 105 people and helped them find the information they needed. And we also gave out about $60,000 in financial assistance and prevention grants for the individuals that needed assistance to get in to start their journey. One of the things we're very proud of is ARCHway is now celebrating our 10th year of service beginning in 2022. It's a very significant accomplishment for a nonprofit to sustain their business this long, which means we obviously are serving a need that's out there. Two things we want to show you in that 10 years is that we've gone from having a revenue stream of about $20,000 in 2013 to close to 400,000, and the number of followers we have is getting very close to 5,000 now. And you can see the more people we help, just like the stories I showed you, the more people we help, they tend to be long-term supporters of ARCHway. And then they also become that group of folks that donate money to help the next family up. We also have a program of Hope Fund sponsors. These are folks that have committed to someplace between $5,000 to $50,000 in donations over their lifetime to help pay for our free services. And we have 76 Hope Fund sponsors. They're our major donors, and we add about 8 to 10 a year. of people that want to help and help the next family up. We do big things, and sometimes it's the little things. Probably our biggest project this year is ARCHway is really believes in peer support specialists and the work they can do to help families and help the individual really want to get into a recovery program. And so ARCHway is going to be sponsoring the National Peer Recovery Alliance nationally, and they will report to into the ARCHway organization. And we just feel like this will take our ability to have peer support specialists that currently we're helping about 105 families a year to this could be tens of thousands of families a year we could help if we continue and can grow this National Peer Recovery Alliance in all the states in the country. This is a big idea for ARCHway going forward, and you'll hear a whole lot more about it in the future. Well, at the same time, ARCHway does some of the small things. And one of the big one that we're just doing right now is doing an underwear clothing drive. A lot of times people that want to get into recovery are homeless, coming from the streets into treatment, but they currently cannot, they can't have access to underwear. They can have access to all other sorts of donated clothing. And sometimes something as simple as this can keep somebody from getting in into a treatment program. And so we did a drive to have people donate new underwear that can be donated to individuals who want to get into recovery. We've worked with a number of treatment centers in 3 different states to collect and distribute the underwear to folks that want to get into recovery that just don't have the means to right now to help themselves. In Southwest Florida, or in Florida, we have about 21 Hope Fund sponsors that help drive our programs and help in Florida, as well as hundreds of other people that participate in our events. But you can see it's families, it's individuals, it's treatment centers, it's businesses, a whole community coming forward to help individuals get the support and resources they need. To give you an idea of what we do in Florida, we have we have the largest amount of calls for advice, input, and resources come in from the Florida area. And at the same time, we've given out the most grants in the Florida area. And you can see they probably go hand in hand with wherever we get the most requests for help is also the money can follow those grants as well. You should also know when I was showing the financial models that we are 100% privately funded, no state or federal grants. All the money we get are from families and businesses that want to donate to ARCHway to help their community and have us help their friends and family find the treatment they need. So then, because I was giving this presentation to the Drug-Free Punta Gorda Coalition, and sometimes we get asked the question, so why is ARCHway a member of the coalition? You know, Drug-Free Punta Gorda is focused on prevention. ARCHway is focused on recovery. I think I've talked about the impact of genetics. Trauma has a huge impact on individuals that can trigger the addictive disease. And the other statistics, the earlier you address addictive behavior, the better chance you have of being able to manage it. So that means we want to be as close to the prevention programs and catch those folks that that do get triggered at an early age, that we might be able to take a handoff and help them find the support they need. So we have two different areas of focus, but we have the same passion to serve this population of people that can be affected by this disease. How else does ARCHway help with drug-free Punta Gorda? We give our time. We have many ARCHway volunteers go to drug-free Punta Gorda events to both volunteer and participate. We give out grants and money to help pay for prevention programs in our community. And we think another big one is we give drug-free Punta Gorda visibility at ARCHway events to help educate the community about other programs that are happening, very positive programs that are happening in their community. So again, we give our time, we give our money, and we give visibility to drug-free Punta Gorda. And one of the things we're doing right now is partnering with drug-free Punta Gorda to hopefully raise money to pay for a grant, as well as for them, as well as have them involved in our events here in Punta Gorda or in Southwest Florida. So we have a challenge, which we challenge people at Drug-Free Punta Gorda to participate in our golf and charity event, or just come to lunch wearing the Drug-Free Punta Gorda shirt. And to just come out and get involved and be publicly visible. We are very excited. We have a speaker who's coming, who came through our program through our Florida event. And Adrian is going to be very exciting to come and tell her story about how ARCHway and the support we all gave changed her life. So it should be a very exciting event, and we're excited about our speaker. The last thing we're doing with Drug-Free Punta Gorda is ARCHway's teaming up with them with a goal of raising $5,000 in 2022 through the helicopter golf ball drop. And currently, ARCHway would pay for the administration of the event. We would pay for the prizes, as we do this nationally. But you have an opportunity, if you want to donate specifically to Drug-Free Punta Gorda through the helicopter golf ball drop. We're trying to raise $5,000, which ARCHway will give a grant for whatever the amount ends up in December. Currently, we've raised $900 out of the $5,000. All you have to do is, when you go on the website and register, is when you see choose a selling partner, and the registration is to pick Drug-Free Punta Gorda. And with that, we asked all the folks at Drug-Free Punta Gorda for some positive, interesting, and negative feedback about the presentation and what ARCHway is doing in the community. And I hope this was helpful in giving you a better picture of what we do, both nationally, regionally, and locally, and as well as have a better understanding that we really do represent or are the advocates for the family and individuals when it comes to helping them find the resources they need to start their journey of recovery. Well, thank you very much for listening.